Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside some of the best plastic surgeons in the country. Now I don't work for anybody, so I have unbiased opinions about hundreds of surgeons from across the world, and I can help you achieve the body of your dreams. Hey guys, do I have the episode for you today? You guys are not going to believe it. I finally got my surgeon to come on the show. I am so excited to have Dr. Germán Newell, board certified plastic surgeon out of Houston, Texas. Hello, Dr. Newell.
Hi, Mavi. How are you? Good to
I'm
see you.
doing good. I'm happy to see you too. I am so happy to finally share my surgeon with all of my girls, my audience. They're always asking me, who did your work? Who did your work? Dr. Newell, he's in Houston. Y'all got to come see him. So I'm so excited to finally get you on the show and get to talk about your amazing talent, which I think is combination surgeries.
Thank you so much, Mavi. It's a pleasure to be here with you all and share my
Thank
experience.
you. Dr. Newell, so I'm going to talk a little bit about something that's a little controversial online, which is combination surgeries. And I've talked about my surgery, which I had a tummy tuck, lipo 360, BBL, all in one sitting. And you did all of that. And you know, as much as I know, how much controversy there is about doing multiple procedures at once and doing a tummy tuck at the same time as a BBL.
Yes. Well, I think the most important thing in any kind of combination surgeries is the issue of safety. We have an extremely safe team. We approach it in a team fashion, anesthesia, surgery, all of that. We take all the precautions necessary to avoid complications such as blood clots, which is the most dreaded complication. We use anticoagulants in all our patients. So we have it down to a science. And I think it's typically a very doable procedure. We do it all the time. It takes me about 2.5 to 3 hours to do the combination tummy tuck, 360 liposuction, and a BBL, and that is a very safe time. So I feel very comfortable doing that operation, and uh, and have no issues with it at all.
So, something that I really love about your technique, and I would love for you to tell us more about it, is that we can sit post-op day one.
Yes, yes. The technique I use is the most advanced technique. It's a roller pump technique, which allows me to put fat in pretty much everywhere in the buttock in a very safe way, from above down, to avoid where all the vessels are that can give you trouble. With this technique, you can sit from day one and not displace the fat that you place. Now, typically, with this technique, you can get a 70% fat take, meaning that of all the fat that I put there, 70% stays forever. And you lose about 30%, which really is the best take there is in the market. So no, I feel very comfortable with this technique. It's safe, and again, the results are outstanding.
And I really love that we can sit day one because that's probably one of the things that I hear a lot of my girls who come to me and they're like, "Man, I want to have a BBL, but what? I can't sit for 6 weeks."
Yeah. Well, that was a tough situation when you can't sit down for 2 weeks. How are you going to do it? So that's when we evolved this technique of the roller pump, which allows us to put all this fat everywhere. Now, most people still use the syringes, and that, of course, is limiting the amount of fat you can put on. Of course, they tell you not to sit down because they want to maximize the take. But with a roller pump technique, there's no issue
And
as
can you
such.
tell it, Dr. Newell, my audience is very educated and they will go research whatever you talk about, they're going to go
Yeah,
look it up. So, can you tell
sure.
us a little bit about what that roller pump technique, what does that mean?
Well, it's that the same machine that we use to mesh the tissues when we do liposuction. We came up with this idea of reversing that pump and then suctioning away whatever fat we had placed through that little roller pump and push it out through a different cannula. and then direct it into the buttocks. It's the most advanced, and right now is pretty much all the gurus of fat grafting are really using it. It's just the best.
And it has, I mean, it you guys, my fat took whatever he put in there, it's there. It's still there. And how long ago was my surgery? 2017. That's yeah, it stays. It's still in there.
Okay.
And I love my results, Dr. Newell.
That's great. I'm so glad you like it, Mavi. I just always try to do my best on all my patients and try to give them that really hourglass figure and chisel look.
Well, you know what? You just touched on something that I think we should really go into because you don't know this, but you were my second consultation. So I had had a consultation before you, and the surgeon that I saw, his recommendation was to lipo my hips down
Mhm.
straight.
Right.
And that's not what I wanted. I
No,
went to
no,
you and you were like, "Oh, it's okay, sweetheart. We're going to put some fat here. We're going to take it out of here. We'll give you some curves." And I was
that's
like,
right.
"You go, Dr. Newell. You do that to me, please."
That's that's right. Well, the whole idea is fat redistribution. So you take away the areas that you dislike to create a more uh, snatched look, as they say now, and augment areas that you are lacking fullness. The hips, the trochanters, the buttocks. It's a unit, and it's all an aesthetic unit, and you can have great results rather than throw it all away and giving you a boyish look, which is not what I desire.
Exactly. It wasn't what I was desiring either. And you know what? After my surgery, Dr. Newell, due to the confidence that I gained from my surgery and going off into the world and seeing how I saw the change in other women in
Mhm.
their lives. And it's something actually that I saw that you talked about, which is it's not so much about the surgery on the outside, it's about the transformation that's happening on the inside.
That's right. It's a combination. When you look good, you feel good, and you express yourself in different ways. It's confidence that you lacked before. It's all everything comes through the eyes, and that really pumps up your psyche in so many different ways. And yes, I love that because really it's not only the material part or the physical part, but the mental part that also it's improved.
Dr. Newell, and I know one of the things that I always saw in your office was such a big Latin community. You have such
Yeah.
a large Latin following, and I think honestly, las que están escuchando que hablan español, el doctor Newell habla español.
Claro que sí. Son mis roots. Yo vengo de Latinoamérica y soy peruano. Y por lo tanto, las curvas latinas son lo que me gusta a mí. Entonces, eso es lo que trato de
Exactamente.
hacer.
Y lo haces muy bien, Dr. Newell.
Thank you, Mavi. Gracias.
So let's talk about this sitting after the BBL process. I know
Yes,
you give us the permission; we're allowed to sit. Can you tell us a little bit about after a BBL? What are some precautions that you recommend for your patients? Our audience is always looking for information that can help them make the best decisions on their surgical journey.
of course. Now, we use garments, compression garments, for about 6 weeks. Um, and that is very helpful because it molds the buttocks the way that I created them. Um, Now, there is a process, and I tell my patients don't criticize what you see the next day or even the next month because it takes up to 7 months to see this process, this curvaceous look get better. So hold their hands and say, don't be critical. It's not over yet. So, so as long as you know and you are well informed that it will take up to 7 to 8 months to see the best results, patients are fine. You have to inform them, and once they know that, they are okay. Um, it is a very uh, nice process. Like I said, we have to work with your own anatomy. So we cannot create something that you don't have, but we can enhance what you have and make it better.
That's beautifully said. I love how you said that. We can't make something that's not there, but we can enhance what's already there and make it better.
Yes, yes.
That leads me to this question that are you what trends are you seeing as far as what patients are coming in and asking for
Oh,
BBLs?
yes. Now things have changed in many ways. For example, I see the trends in breast. Big is not better anymore. It's maybe perkier, smaller. That's one trend. In buttocks, uh, more buttocks, more curvaceous forms is better, but not excessive either. So the natural look of a curvy, delicate body is better than a really blunt and aggressive change. I think natural looks by far are better than the really, you know, curvious, too grotesque. Let's put it this way.
Mhm.
Changes.
Absolutely. Dr. Newell, something that I always noticed in your office was the BMI range of patients that you would see.
Yeah.
And I knew it was because you were very comfortable in what you do and you're a professional. You're an expert.
Yes.
You know how to handle the higher BMIs. Why don't you tell us? I just had an episode recently about BMIs and the importance of being within a certain BMI. Can you tell
Yeah.
us a little bit about that?
Yes, and we don't operate on patients with a BMI higher than 45. And the reason being is more of an anesthesia risk. Um, when patients are rather large and have such BMIs above 45, the risk of having problems with anesthesia are higher. Similarly, in the way they heal. So the optimal BMI, of course, is below 45, 40, below that. Um, of course, 30, 25 is better than 44, but it's doable after that's safely done. And we take all the precautions to avoid complications, and I have fantastic results with patients that have a rather higher BMI than normal, around 44 or less, and that's fine. We can make the changes, the adequate changes, and hopefully the patient will change their bad habits and go back to a very athletic BMI.
You know what? That's something I always talk about on the show about after your surgery. It's either going to motivate you to change your eating habits and change the way your lifestyle so that you can maintain the results,
Yes.
or you don't change and you just continue to live and eat how you were living and eating, and you might not last, your results might not last.
Exactly, and again, I know, and you know it, Mavi. This is not magic. I mean, I can make changes that are beautiful and very desirable, but it's up to the patient to maintain them. I can't do more than that, and I think the majority of patients understand that. But there's a little part that really feel that this is just a procedure to lose weight, and it's not all about that. It's about changing your bad habits and making you look your best.
Exactly. And after you have surgery, like for me, it motivated me to make lifestyle changes to keep so I could keep my results. And let me tell
Yes,
you guys, a few months ago, maybe it was last year, I went in to see Dr. Newell with a friend of mine who was going to have surgery with him. And I showed him my a very small part of my incision where my scar is a little bit not thick, but it's just a little raised, but it's the only spot. And you know what Dr. Newell told me? He said, sometimes you don't break what's not broken. And I really want us to talk about that because I feel like there's a chasing of perfection in
yes,
plastic surgery. And I want us to be realistic. And you put me in my place that day. You were like, Mavi, like, you look great. Your incision is perfect. Like, live your
Yeah.
life.
You touch upon a very important issue. The enemy of good is better. You try to achieve perfection. There's no such thing as perfection. Uh, you got to realize that if you look good, be happy about it, uh, because perfection doesn't exist. And sometimes, like I said, the enemy of good is better. You try to go for that, and you get a complication, and things go downhill.
Exactly. So I've always really appreciated how you were so honest to with your patients, and you were always caring about, you know what? It's okay. Save your money. We're not going to go for more surgery. You don't need more surgery. And I've always really appreciated that and admired that about you, because it's not something that is a given across the board.
Yeah. I agree, Mavi. I care for my patients, and I know what I can give them and offer them, and what I can't. And I will never mention something that I cannot deliver. And you just have to be honest with yourself and say, hey, this is as much as I can do.
Absolutely. Dr. Newell, give me 1 second. Let me read my notes about what I had here for you, because I was
Okay.
so excited to have you on the show today. I was like, yes, I can't wait. I get to showcase my
Thank
surgeon.
you, Mavi.
I'm so happy. One of the things that you did for me during my surgery was, after my BBL, during my BBL, you blended it into my legs.
Yes.
So,
Yes, and I do that routinely, Mavi, because it's one aesthetic unit, and it's just the buttock part, the outer thigh called trochanters, and it goes down to your lateral component of the thigh. You have to make it smooth so that everything blends beautifully. So yeah, it's like sculpting. You want to make the best out of it. You can't create a big buttock on chicken legs. It just doesn't look good. So you have to blend everything so that it's proportional. Everything is about proportions, and that's the answer for beauty. Proportions.
and I think that definitely was the key, because once I noticed that, and then I started noticing other people's BBLs, I was like, oh, okay, I see what he did. I see why he did this, why he does this. And
Yes.
we can talk a little bit about it. When you don't do it is when you get ant booty.
Yes.
Have you seen the
Yeah.
ant booty?
Yes. Yes. It doesn't look good. Again, it's you can't just do one area without touching upon others. So, and I tell that to my patients. Sometimes they say, "Well, why do you have to go there?" I say, "Well, because if I don't, then it doesn't look as good." So, as long as you explain things to patients, they do understand and they will agree with the plan.
Absolutely. I listened, I understood, and I said, I'm going to do whatever Dr. Newell tells me to do, because I want to look like one of his girls.
That's right, and you do.
And I do. Actually, when people ask me, I always tell them body by Newell, body
Yeah.
by Newell. I did after my mommy makeover. About 2 years later, remember we were gonna do my breast, and we were like,
Yes.
no, maybe not. We'll wait. You told me, wait. You might decide you don't want to do it later. And I said, okay. And at first I was like, you know what? I don't even mind them anymore. Now I can just stick them in a bra. My stomach's flat. I
Yeah.
look You gave me the hourglass. But later I came in and we talked about breast again. And one of the things I heard in one of your consultations was about breastfeeding and breast work. And
Yeah.
we haven't talked about it on the show, and I'd really love to talk about it.
Yeah. Well, if you do, of course, a breast reduction, you're taking parenchyma away from your breast. So yes, you can breastfeed, but the amount of milk production is going to be lowered. So yes, people that have a breast reduction lift will will be able to breastfeed, but they might need formula to add
Okay.
to the situation. Now, with a breast augmentation, I typically put the implant under the muscle, and so there's no contact with the breast parenchyma. So all the patients that have breast augmentation and breastfeeding, no problem. It's okay. So no, the answer is you could breastfeed with patients that have some sort of breast surgery, whether it be an augmentation, whether it be a lift, whether it be even a reduction.
Absolutely. And I heard in your consultations when you would recommend to your younger client, your patients who would come in who haven't had kids yet, that you would tell them it's up to you if you want to go through.
Exactly. Exactly, and that's information they need to know because when you are pregnant and you deliver, a lot of the parts of your body change, and I hate to do a breast lift on a very young patient, and then she has two or three pregnancies, and the breasts drop a little bit. So it's important that they know. Now, I've had patients that had uh, a tummy tuck or a breast lift, and they got pregnant, and they retracted. Some do, but some don't. So it's one of those things. Uh, you just can't be sure all the time.
That leads me to this very, very funny common thing that happens, Dr. Newell, and I know you know that after they have their mommy makeover, they get pregnant.
Yes, yes. It is unfortunately true. They become so good looking and desirable. Husbands just
Can't keep their
get
hands off.
uncontrolled.
So let's talk about what if somebody gets pregnant after a tummy tuck? What happens? What can they expect?
You know, I've seen many of my patients get pregnant after a tummy tuck, and I would say that 85% to 90% of them, once they deliver, they retract and they're fine. There's a small percentage, like a 10%, that may have some excessive skin still there that they decide to excise and get rid of. And well, I can do mini abdominoplasty, touch-up abdominoplasty, but not to the extent of the major one. But yeah, most do fine.
Do
Most do
they
fine.
do you have to, like, if they get pregnant, l- I swear to God that 3-month range, they're that's usually when I hear, "Oh, I'm 3 months post-op. I have a positive pregnancy test."
Yeah, yeah,
So, what do the muscles I'm assuming because I've heard you talk about it.
yeah,
They
yeah,
stretch kind of like a
yeah.
first time pregnancy. It
Yes,
would the tightness you would feel.
yeah. They can. Now, when I do the repair of the muscles, typically takes between 3 and 6 months for that muscle to be totally healed. That's why I tell my patients no crunches or hardcore exercises for 6 months. Of course, if you get pregnant before that 6 month period, then you can stretch those muscles again. So that is the window where they can stretch those muscles again.
Okay, so they could possibly stretch within that 3 to 6 month range when
Yes,
it's not completely healed, but after
yes,
that they'll just be pushed out.
yeah. After that, the strength of the muscle is there, so the stretching is not that
Mm,
dramatic.
that's why they don't end up with a lot of excess skin.
Exactly, exactly.
Okay, so if you're listening and you got pregnant and you're like in the first few weeks, you know, okay, I what to expect. Now you heard from Dr. Newell what could happen in the next 6 to 8 months, and after a pregnancy, Dr. Newell, how long does somebody have to wait to have? Like if somebody's pregnant right now and they're like,
Yeah,
okay, this is my last kid, this is
yeah,
it, mommy's getting redone.
yeah.
How long do they have to wait?
Well, I usually tell them between 4 to 6 months because remember, your uterus has been stretched and grown, and you want that uterus to be uh, reduced to its normal size before you go and tighten those muscles because that will impede you from making a good repair. So I usually tell them from 4 to 6 months because that's how long it takes for the regression of the complete regression of the uterus.
And usually by that time, like a lot of the swelling and a lot of like the pregnancy weight is kind of coming off. So you say if you're going to have a tummy tuck after pregnancy, usually wait 6 months.
Yes, yes. Usually you wait about 4 to 6 months.
Perfect. So if you're listening now, you know you can time it out and schedule your tummy tuck at least 6 months after your last baby.
That's correct.
Dr. Newell, it was such a pleasure to have you on. I'm so happy. And you guys, I love Dr. Newell. If you're looking for a tummy tuck, if you're thinking about having a mommy makeover, Dr. Newell is definitely the place to go. If you're here in Houston, the place to go. If you're traveling, the place to go, because let me tell y'all about his surgical facility, and not just his surgical facility, but his office, his staff. His coordinator is Maggie and Patty, and these girls have been with Dr. Newell for how long, Dr. Newell?
Patty about 24 years, Maggie about 15 years.
Yeah. So what does that tell you? To me, that says these girls are happy because he's a good surgeon and he takes care of his patients and he's a stand-up guy. And not just that, the facility, you guys, it's a 5-star beautiful office. You walk in and the smell. If you listen to the episode of we had one of your patients on and she was telling us about her experience. If you
Oh,
listen
yes.
to the episode about Melanie, she states, I walked in and I smelled the office. She's like, I knew that was it. I'm staying here.
Yes. Well, we take great pride on our staff. Um, uh, they are fantastic people. They've been trained to the T, and we care about patients, customer service, all those little things that you don't see in every place. We do. We send our nurses for follow up in their houses. I mean, nobody does that. We go above and beyond of whatever the standard is to make sure the patients are happy. So yes, we do it all.
You do. And Dr. No, I do want to do a special mention of that beautiful bow tie. And you're always wearing your beautiful bow ties.
Thank you so much, Mavi.
They look great
That's
on you. And if you go in to see him, you're going to see him dressed up in a really nice suit with his really nice bow tie, smelling great, and just going in and turning moms into hotties left and right.
Thank you, Mavi. You're so kind.
Dr. Newell. So if my girls want to come see you, where can they come see you?
Well, I see patients Tuesdays and Thursdays at the office, and just make sure that they can call Patty and Maggie or the answering service, and they can contact them, and we'll take good care of you.
They will. Dr. Newell, I know anybody who comes in to see you, you guys, if you come and you're telling you learned about Dr. Newell on the podcast, tell him Mavi sent me so he knows
That's
to give
right.
you the special Mavi treatment.
Of course, always, always.
Thank you so much, Dr. Newell. It was such a
Thank you,
pleasure
Mavi.
to
It's been a
have you
pleasure
on.
seeing you. It's
It
been a
was
pleasure
good
seeing
seeing
you
you too.
and talking to you. You're fantastic.
Thank you, Dr. Newell. And with that, I will see you guys next week.